Welcome, everyone, to Addressing Mental Health in Today's Immigration Landscape. On behalf of LMHANJ, we're very excited to come together to discuss this very timely and relevant topic that is the intersection of immigration and mental health. And we're so grateful to our speakers for sharing their experience, their expertise, and passion for these topics. I think we could all agree on the critical need for a safe space to openly dialogue about our current immigration happenings and concerns, as well as the impact that it has on us as people and us as mental health professionals. Before we start, I want to give a really quick shout out to all the social workers on the call. Happy Social Work Month. We truly hope that you feel seen and validated and celebrated for all the valuable work that you do. I think that this presentation will really be a testament to just how much the world needs social workers and all mental health professionals in our lives. And also, before we get started, I want to share a few details about what's happening with LMHANJ and opportunities for you to engage. Our annual conference is coming up on March 21st at the College of New Jersey. We have a really solid and exciting lineup of timely topics where we're going to be continuing the efforts to connect and build community. We're offering member and non-member rates as well as group rates to make sure that you take a look at those. Also, we have a lot of CE credits available, so lots of reasons to come and join. Registration closes on Friday, March 14th, so please make sure to register, and we do hope to see you there. The Association of Latino Professionals for America, the New Jersey chapter, is hosting a book drive within the East Orange community on April 5th, 2025. We're going to be supporting this endeavor by holding a book collection at our conference. So if you plan to attend, please bring a children's book with you, a new or lightly used one, to help donate to the cause.
We also want to bring awareness to our scholarship fund that we have going on right now. As you all know, this event is free, but we are encouraging donations to our scholarship fund. It really looks to support graduate and doctoral students who have a commitment to the Latinx community. So we really appreciate any support to this fund. Here on the bottom corner, you'll find a QR code that can direct you to learn more about this fund and donate if you're being called to that. You can also look for information on our website on the LatinoMentalHealthNewJersey.com. We're also really excited to announce that we're going to have a part 2 to this discussion. We understand that this conversation is ongoing, and we find it extremely important to continue this conversation. So on April 2nd at 7 p.m., we're going to have a part 2. This is going to be a lot more informal and just being open to open dialogue so we can all talk in an informal setting. So again, save the date, Wednesday, April 2nd at 7 p.m.
All right. And with all of that, we will dive into our presentation. We'll start with giving you a little bit of orientation to our speakers. My name is Angela Vargas. I'm the current president of LMHANJ. I'm a New York and New Jersey state licensed psychologist and also the owner of Via Psychology, a private practice that specializes in all psychological evaluations, including those for immigration cases. By training, I have experience across the lifespan with communities of diverse backgrounds and resources and in numerous settings, including public hospitals and community mental health centers. My specialty areas include treatment of mood disorders and trauma, being via individual, group, family therapies, as well as psychological assessments and comprehensive evaluations. We also have Erika Hurtado, our current member at large, who's a licensed clinical social worker. She's a passionate and experienced therapist dedicated to empowering individuals on their mental health journeys. As the owner and founder of Unscripted Therapy, a private practice in New Jersey, Erika specializes in providing trauma-informed care to teenagers and adults. She also provides comprehensive immigration evaluations for youth and adults. Veronica Cardenas is an immigration attorney, writer, and public speaker dedicated to reshaping the narrative around immigration law. A former assistant chief counsel for the Department of Homeland Security, she now leads Humanigration, a platform empowering immigration attorneys and advocates through strategic guidance and training. Veronica frequently appears on MSNBC, ABC 7, Pix 11, and Scripps, providing expert analysis on immigration policy. With a mission to make immigration law more humane, relatable, and attainable, she uses her platform to amplify immigrant voices and advocate for systemic reform. And Ivonne Salazar joined La Casa de Pedro in October 2022 as the Vice President of Development and External Relations. In November 2024, Ivonne was promoted to Chief of Staff and serves as a member of the executive leadership team. In this role, Ivonne Salazar serves as a strategic advisor to the President and CEO, driving key functions and projects and ensuring effective collaboration and integration across the organization. I will pass it over to Veronica to get us started.
So, today for this presentation specifically, I want to focus on immigration and customs enforcement. Immigration is a very large and vague term, and with immigration and customs enforcement, they are primarily required or authorized by statute to enforce immigration laws. And so, immigration and removal operations, which is one branch of ICE, they're the ones that do the detaining. They process people, whether there's bed space or not. They're the ones that are making those determinations, whether they want to parole someone. And then I'll briefly also speak about Homeland Security Investigations, which is a different branch under ICE. And ICE was born out of the Department of Homeland Security on March 1st, 2003. It was conceived in the wake of 9/11 under the guise of national security. And so this year, ICE just completed its 22nd birthday. And even though the war on terror has faded, its legacy endures. And today, the Trump administration is repurposing fear, resurrecting restrictive policies, not to combat terrorism, but to wage a new war on immigrants. And with rhetorics that pledge to hunt non-citizens, this administration is leveraging national security to justify sweeping action. And 2 weeks ago, Illinois Governor J.B. Pritzker said that tyranny requires your fear, your silence, and your compliance. Democracy requires your courage. And I feel like that's such a beautiful quote in this time because it is really up to so many people to stand up, to have the courage to do the right thing. And when we speak about immigration, it's not just the lawyers, it's not just the law. Immigration touches so many parts of a person. And there's also studies that have been shown that in order for a person to have courage, it's deeply tied to how they feel about themselves and whether they feel worthy. And when we look at immigration laws, a big part of that is for a non-citizen to prove their worthiness. We're always having to prove that we qualify, that we're exceptional in order to get status. And so I think that having this conversation and seeing where they meet is extremely important. So today we're going to go through these topics. I want to briefly touch on Trump's use of executive orders, not just what the orders are doing, but the way he's naming the orders, because there's so much that comes from the language that he's using to really establish that all non-citizens are threats. The means, which is the language and other executive orders to justify the removal and what the purpose of removal is. And we can't talk about removal or deportation without talking about the detention. And then how his administration, but not just the Trump administration, administrations before him, starting with Bush, how they really have manipulated immigration laws to further their own political agenda. Okay. So immigration is civil. And one of the things about civil immigration is that they don't have the full constitutional protections of criminal law. And so when immigration was created and when the laws were established in the 1800s, early 19th century, there was immigration detention was never used or supposed to be used as a tool to punish or deter. Because once you have punishment, once you have deterrence, then the law states that a person should have all of the constitutional rights afforded to people, which means that there's a presumption of innocence and there's a presumption of liberty. Immigration, though, is just the opposite. In immigration law, they start with a presumption of guilt. For ERO to process someone and put them into the immigration system, a single passport showing birth abroad or an identification showing birth abroad is enough to prove what the law calls alienage. And there's also the presumption against liberty. So immigration court and immigration laws presume that a person is dangerous and that they should therefore be detained, even though it's civil. And detention has been used as the greatest deterrent because detention facilities, especially immigration facilities, which are contracted out to private companies, are known for their human rights violations. And then we'll speak about, everything that we're seeing from ICE's now social media page, Dr. Phil going on ride-alongs with ERO to arrest people, how that's all perpetuating this narrative that you put handcuffs on a person, they must be dangerous. So we'll talk about that. So in my time with ICE, and I've been there where I was there I started in 2010, I never saw like social media the way that ICE has been using social media now. If anyone has visited their Twitter page, their Instagram page, or X, they are really taking the position that everyone and anyone is a priority. On Instagram, they have this thing, the worst first, and every officer in every state, as they go out and they make their arrests, they're taking pictures of the non-citizens as soon as they handcuff them. And with that, they're writing what their supposed crime is. And now we all here know that immigration is a civil violation. And so to make it seem like it's the worst first, there's taglines about how a person is perhaps crime, sexual abuse of a minor, or crime, human trafficking. And this is really inaccurate, or at least vague, in the way that this administration is defining the word crime, because it doesn't mean, or it doesn't equate to a conviction. There have been many times where an arrest alone is sufficient to apprehend a person. And even though immigration or maybe the state can't proceed on a criminal conviction, they turn them over to ICE so that ICE can just process that person's removal process, because the immigration court is very tough. And just by being born abroad, that already gives the immigration court jurisdiction to proceed with an immigration case. So here we see pictures and to see who is being arrested, right? What the statistics are to show, like, are these people actually convicted criminals and are also non-citizens, or have they just have an arrest, or are they just overstays? People who have overstayed visas, which the webpage also shows are priorities. So this is a video. Move on, but the point here was they've also started to record people getting on removal flights. And I don't know if anyone has ever spoken to people who've actually been removed from the US. This is the way that they treat people despite, whether or not they're actually a danger or not. So I've had clients who've been like 75 years old, had medical issues, and they crossed through the southern border seeking asylum, and they are treated in this way. They're shackled from their hands on their feet. Their waists are also chained up so that when they're on the plane, their hands have to be tied to their waist. And, if there's turbulence, if there's an emergency landing, since all of these are charter planes and they're not the best, they've had issues flying, they have to go through the removal flight, or when they're changing facilities, because that's another thing. ICE has the authority to basically move people. And in New Jersey, we might have, but as of now, there's no actual detention facility besides Elizabeth. And so when people are arrested in New Jersey, then they're taken to Pennsylvania, Moshannon. Right now, we're seeing people being transferred to Texas, to Louisiana. And so every time a non-citizen has to switch states, has to board a flight, this is the way that they're treated. And it really does leave a lasting impression. There's a lot of shame because they're treated in this way. And as we get through the slides a little bit more and we talk about the elements of immigration law, the laws are very unsympathetic to the way the secondary effects of everything that ICE does. The rhetoric, the words, the language, that all really matters into how the officers feel in what their job in enforcing immigration laws. And so Customs and Border Protection is another agency within the Department of Homeland Security that is in charge of manning the borders. So anything that's coming through the borders, they're inspecting it, and that includes people. But there's just been such a culture with CBP that they, as this column says, like they treat you like you're worthless. And there have been many studies done to see the human rights abuses of migrants coming in through the border. And the one that like really comes to my mind was when back in 2018, when unaccompanied minors were coming through the US and many children were dying at that point. And that's because CBP did not have the training to recognize whether a child needed immediate care. And so things that could have been avoided were not, because someone says they're not feeling well and they skirt the issue. They don't really care. And so when people are waiting for buses to be transported from the border to a detention facility or to a holding facility, they may have only 2 buses. And so people have to wait a very long time, hours, before they get to where they can get to and get water and food and all of those things. So the system just was not created to be used in the way that immigration is now using it. And we can move to the next slide, because this is not just a CBP problem, this is an ICE problem. So, or all of immigration. So ICE is, like I said earlier, responsible for detaining people, to parole people too. So if someone comes in through the southern border and they're seeking a credible fear interview, and that's like that's the initial screening process to determine whether that person can actually come into the United States. And ICE has the authority to release that person on parole on their own word if they want to. Sometimes they do that, many times they don't. And the question to explain the difference between ICE and CBP is that ICE, ERO, and HSI, which are 2 different branches under ICE, they're responsible for detaining, processing people. So they issue notices to appear, and they deport people, which under the law is called removal now. There was a change to switch the language there. CBP inspects anything that's coming into the US at the international land borders. So they're stationed at the airports, they're stationed at the southern borders, they're stationed at the northern borders. And so that's essentially the difference between them. So CBP can get someone as they're coming in through the border, but then they turn them over to ICE, and ICE takes care of whether they're going to detain them or not. So there have been all of these violations. They don't get adequate medical care. When they try to raise these issues through a habeas, because immigration judges don't even have the ability to hear why someone is not getting the medical care, or to hear that the conditions are so detrimental to them that it's like a punishment. And that's the word I use, because these things can feel like punishment. And if once detention becomes a punishment, they're entitled to the constitutional protections, having a judge hear their case for bond and taking that into consideration, but immigration doesn't get there. And so they ignore these issues. There have been allegations of sexual assault in detention centers, unsanitary, unsafe living conditions, forced labor allegations. And these all have very real consequences for non-citizens and their families, because I do think it trickles down to their children. And so just, going back to the distinction that immigration courts were never meant to be used in the way that they're being used. And when we're talking about mental health issues, the detention is one aspect of it. And even though people do need, assistance, breaking down everything that has happened to them, if they are detained for prolonged periods of time, that really isn't going to get them any type of relief in the immigration court. And most times a judge won't even want to hear about it because it doesn't go to any of the elements for actual relief, for their application to be approved. So I wanted to briefly touch on asylum, cancellation of removal, and whose burden it is, because I think these are spaces where having reports in the immigration court's file, can really help a person win their case. So when we're talking about asylum, the person has to prove that they were harmed or they face a threat of persecution, and that the reason that persecution was done is on account of their race, religion, particular social group, nationality, and political opinion. And so for reports in this case, like let's say we're dealing with a victim of domestic violence, it may be very difficult for them to go into court and speak to a male judge who they already have issues trusting people in government, and tell them about everything that happened. Because when you're in immigration court, they want to know every single detail, to what color shirt you were wearing that day, how many people there were, how long did this happen. So those details, having that in a report could really help an asylum applicant, and also the lasting effects of persecution, because harm has to rise to that level. And persecution isn't just something that is temporary. It has to have long-lasting effects. So speaking about the physical harm and also the psychological harm. And then cancellation of removal, that is if a person has been here for 10 years or more and they have U.S. citizen or lawful permanent resident children, spouses, or parents, they could qualify for a green card that way. And so really speaking to the hardship of how their family members who are here will suffer if that person's removed. And then understanding that non-citizens in immigration cases, they always have the burden to prove their worth, because after a person proves all of these elements, they still have to show the judge that they're worthy of this discretionary relief and why their case should be approved. So with Trump's policies, which are very, very specifically worded, he's speaking about invasions. He's speaking about returning not the term non-citizen back to aliens. And even though most people don't know the way the executive orders have been written, it really goes to the public sentiment of what he's trying to show and the power play that he's making here against non-citizens, protecting the value of American citizenship and trying to withdraw birthright citizenship. So I feel like these, even though most non-citizens don't know the terminology, they really do feel the environment, and they're very fearful right now of leaving their homes and never being able to come back or see their families. And so I just want to take you back to the quote of having courage, and that this really is the only way out of this, I think, is really through community and everyone doing their part in helping non-citizens with the mental health they need, with the legal help they need, so that they can really stand up to a system that was never designed to welcome them. So thank you.
Thank you, Veronica. You spoke so fluently about past administrations, trends that have gotten us to this point, and really vividly about what it is that we, as people, as mental health professionals, as clients, just as people, our families are directly facing. So thank you for sharing your knowledge with us. I want to turn the microphone over to Ivonne.
Awesome. Thank you. Hi, everyone. I wanted to thank the Latino Mental Health Association of New Jersey for inviting me here. I'm Ivonne Salazar. I'm the Chief of Staff at La Casa de Pedro. And we'll get right into it and talk about community resources. So our mission statement, just a little bit about us. Our mission is to foster self-sufficiency, empowerment, and neighborhood revitalization. So we were founded in 1972. We are located in New Jersey and Newark. That's where our headquarters are, but we're founded by local activists to meet the needs of at the time, Newark's Puerto Rican community. And we were named in honor of the activist and revolutionary Don Pedro Albizu Campos. And so since 1972, 52 years ago, we've evolved to become the largest Latinx-led organization in New Jersey. We serve 50,000 residents every year under 3 central pillars. So our 3 areas of focus are early childhood. So we really focus on programming for children 0 to 5 and their families. We focus on healthy homes, which is really utility assistance, weatherization, lead remediation and abatement. And then our community empowerment program, which we like to call the Sancocho programming, really gumbo programming. It really focuses on lots of different areas that the community needs: workforce development, adult education, immigration, youth enrichment, mental health, and housing support. So these are our core values, and this is something that we really did a couple of years ago, but really is important as we're talking about mental health and working with the community to make sure that we put this out there for the community. Our values are in English and Spanish: justice, justicia, love, amor, solidarity, solidaridad, excellence, excelencia, belonging, pertenencia. These were just 5 areas that were really important as we grow as an organization. And then who we serve, we are located in the neighborhood Lower Broadway in Newark. So we're serving directly in our community in Lower Broadway. We're serving in Newark, as well as Essex County, and even more so, we are getting community members from Passaic County, Union County, Bergen County, really all over North New Jersey. So talking about community resources, so, really because of our relationship with the community, because of the volume of community members that we serve on an annual basis, last year, we really began to mobilize in September, October, and start to think about what would happen under a Trump administration. When that became a reality, we quickly gathered ourselves to create resources for the community, and really working very closely with other partners in Newark, and especially the New Jersey Alliance for Immigrant Justice. We created several different resources, and those are available on our website at the lacasadonpedro.org, Know Your Rights. So we have a whole section, but just important to note that we have Know Your Rights flyers in 7 languages, and those are available for anyone to download and to print and to distribute. We have Know Your Rights cards, which are commonly known as red cards, in 4 languages. We have an example of what a judicial warrant looks like, and that we do we've done trainings with our staff, and we've done other trainings just to really understand that when ICE comes to a facility, it's imperative that we're checking for a judicial warrant. And so we teach our community, and we've taught our staff how to choose to see that. We also have power of attorney forms on our website. And then we have a mental health, which is a series. We're going to start a series of mental health videos. Really, that came about because of the tragedy that happened recently with an 11-year-old girl in Texas. Her name was Jocelyn Rojo Carranza, who committed suicide, unfortunately, because she was being bullied at school because of her immigration status. And so we quickly mobilized and tried to create a series of videos that would really speak to those issues. We worked with Vanessa de Jesus Guzman, I think many of you know. And so we can put those in the chat. They'll also be in a couple slides. We can check that out as well. And then other things that we've done is resources for nonprofit partners. We worked really closely with other partners so that we could develop a protocol at La Casa Don Pedro. We have about 10 buildings, and we taught all of our frontline staff what to do if ICE were to come to our buildings and facilities. And we also, our board of directors also approved a policy that guides this practice and this process, which we really recommend. We recommend that to other nonprofit partners. So these are what some of our community resources look like. These are, on the left side is the Know Your Rights flyer. Again, we worked very closely with New Jersey Alliance for Immigrant Justice to make sure that we were using, the correct legal language. And then these are the red cards on the right. And this is our video, and we're just finalizing this English one. And then we're planning to do it in Spanish. And this is talking to parents. It provides tips. It has the number for the suicide hotline in New Jersey. It has information on perform care. So we have an English one. We're coming out with a Spanish one. And then we have one addressed to teens as well in English and Spanish. And they will be on our website once we finalize them. They'll be on our Know Your Rights page. So that leads me to one of our biggest community resources. We received funding at the end of last year from very generous funders, several. We just heard from another funder this week, which is a total of around $500,000 in funding so that we can open an immigrant resource center in Newark. We're taking part of one of our facilities, the second floor, which has several classrooms, and we're dedicating it to an immigrant resource center. And we were really careful to note that it wasn't initially we were calling it an immigrant justice center, and we really thought that we didn't want to create false hope in terms of legal representation. There is just not enough attorneys out there for every single person who really deserves representation. And so we were careful to say that what we're doing is creating resources. We're going to do as much as we can to educate our community members, and so that our community members know their rights. We're doing lots of train the trainer programming. And so something that we're doing now is creating this immigrant resource center. It will be a physical space. We're hoping to open April 15th, but really what we're hoping to do with this physical space is do training with partners to distribute resources and to have a lot of virtual resources as well. Referrals for legal services, but really as much as we can do to educate and empower the communities is really what we're hoping to do.
Thank you so much, Yvonne, for all the work that you're doing. I think one of our takeaways here is the importance of community, the importance of collaboration. So I'm seeing in the chat a lot of eagerness to support, to volunteer, and to really bring our minds and our areas of expertise together to really support our community at a really critical time. So thank you so much. Erika is going to kick off our mental health portion of this presentation, and then we'll end with some Q&A.
Thank you, Yvonne and Veronica. That was really helpful to hear that information. So we're going to be moving on to our mental health, and here are some of the things that we're aiming to discuss, but I do want to remind everyone that we are looking to continue this conversation in our part 2. So a lot of the information that we're going to be touching upon here, we want to continue having those conversations. So today we're looking to talk a little bit about identifying some themes that are coming up at the intersection of mental health and immigration issues, what that may look like, what that may feel like. We're briefly also going to be talking about information overload. What is information overload? And what do we do with that information overload? And how do we prevent it from getting overwhelming? We're also going to be speaking about the biopsychosocial model of trauma and giving some information on what that may look like. And lastly, we're going to be able to engage in a skill altogether. I don't know about all of you, but as we're taking on all this information, it would be really helpful for us to end with a skill that we can all practice. So in putting together this presentation, we were talking a lot about what are some of the themes that we're seeing, what are we feeling, what are we experiencing, what are we seeing the community experience, right? And one of the questions that came up was, what is currently under attack? What are we feeling attacked by, right? So some of the things that came up is the sense of safety, right? There's people, we might be feeling like, are we safe? Can we step out of our house? Who can I talk to? What information am I receiving? Can my kid go to school? Is my child going to be arrested at school? Who can I talk to? Can I speak to the people at my job, right? So a lot of sense of safety, or lack of safety for that matter. We're also looking at an attack on our sense of belonging. Where do we belong? How do we engage with other people? Questioning sense sources of community, right? So attack, it's the community. Who can I engage with? Are my coworkers safe to talk to about? Can I step out? Can I step out to buy groceries? Can I step out to go somewhere? Right? So we're seeing a lack of safety in these areas and an attack again on sense of belonging and sense of community, right? Something that Veronica brought up that stood out to me was when we think of an attack of sense of belonging, how much shame comes around that, right? The sense of shame, of feeling like we don't belong, or where do we belong? Also wanting to bring attention to, maybe a theme of return to greater danger and instability. So that may be in us as individuals, it might be somebody that we know, of what's going to happen to them. Are they going to be in greater danger and instability? So really noticing what that's like for us to take in individually, or just as we experience people in the community, what that does to our systems as we're thinking that people are going to return to greater danger. Something important that I think it's important to bring attention to, it's the idea of the spectrum, right? So if you look at the bottom, we have on one end, we might have parts of us that feel a lack of safety, feel isolated, not necessarily knowing what to do. On the other end, we might notice a sense of protection, of wanting to step in, do something with this information, right? So that's more of a sense of activism and wanting to, again, jump in. And so those resources that Ivonne was sharing, we might have a sense of like, how do we volunteer? How do we become part of this? How do we help protect people? So noticing that, and then we might be somewhere in the middle, right? We're feeling really uncertain. We're really feeling really stressed out. We may not necessarily feel a lack of safety, but we don't know what to do with this information that's coming our way, right? So I want you to start thinking of where do you stand on this spectrum? Not necessarily because it's good, because it's bad, but because once we know where we are in the spectrum, we have a better understanding of what to do with those emotions and feelings that may be coming up. So for example, if we're feeling a lack of safety, we might have a better understanding of like, let me work with my own nervous system to really regulate myself. If I'm feeling a sense of empowerment, of wanting to protect, then jump in and do something, I might not necessarily be sitting down and saying, let me take a deep breath while I relax. I might want to go and engage in a community support and be part of a group that's really being called into action. So we might have to do something else with that energy. If we're feeling really uncertain or really stressed out, that may call for something different. Okay, so again, it's not about being good or being bad. It's really informing us on how our system is taking this information and what we can then do with that information. Okay, this is also really helpful for anybody that's a mental health professional to keep in mind, where are your clients on this spectrum, right? We might have our own parts as we show up as therapists or mental health professionals, and being mindful that our clients may be in a different place, right? So we may have energy that's more of activism and jumping in and let's do something about it, but some of our clients may really be stuck in a sense of a lack of safety. So how do we show up for them? And while I'm using the word clients, let's just think about people in our community. How do we show up for other people? So information, right? We're on a spectrum where, do I feel safe? Do I jump into activism? What do I do? I find it really challenging to be able to decide what we do sometimes when we have so much information coming our way, right? We have all this information, all these executive orders, all these different changes. We have people talking to us. We have social media feeds that are popping up that are giving us so much information. So let's take a look at the definition of information overload. So it refers to the overwhelming, again, let's focus on the overwhelming experience of being exposed to excessive amounts of information in a short period. Okay, so it's overwhelming and it's happening in a short period of time. It makes it difficult to process and make decisions. Okay, so when we're having a lot of information overload, emphasis on overload. We're not saying let's not get information because it's important to have information to be educated, but it's also important to understand what's happening to our system when we're having so much information at the same time. So if you look at the image, I want you to think of those pictures being all different executive orders, all different, whatever you can imagine that's happening, and it's all coming to you at the same time. Notice what's happening in your system. Is it easy to process? Is it easy to make a decision? It might be really hard to, right, to decide where are you on the spectrum of what to do when you're having all this information overload. So again, bringing awareness to that, and Angela's going to lead us into some techniques that can be helpful for that.
Thank you, Erika. So the techniques on this slide are really rooted in mindfulness and grounding practices. These techniques really help us to boundary ourselves from all the overwhelming information coming our way and from all the different directions that it comes and its implication on our mental and emotional states from day to day. So mindful consumption is really being intentional about when we tune into the news, when we access social media platforms. Um, if we know that these are forms of decompression, turning on the TV or just mindless scrolling, that might not end up serving that purpose because we can easily then get into the rabbit hole of the headlines and the really emotionally laden news. So I think we have to be really intentional about when we're accessing those sources and know what we can potentially be exposed to. And if what we're really needing for ourselves is decompress, like a moment to decompress, to refresh our minds, then maybe we do something else like grabbing a book, having a book nearby, a crossword puzzle, listening to music, some meditation, a mindfulness practice. Real again, and the key word here is being mindful about how and when we access information or we tap into the information. Second to this is really setting boundaries about the how and the when, right? So we live in a social media driven world right now. We often are scrolling. I think I'll speak for myself. As much as I try not to, I wake up and I pick up my phone. Before I go to bed, I'm probably scrolling through my phone, right? And are those how we want to start our day? Is that how we want to end our day? Especially because it's very easy to find ourselves down that rabbit hole. So really, and I say this for us because it's us as people, as mental health professionals, and it's also the recommendations we want to give to our clients to really be boundaried about the amount of time or the pockets of time that we're engaging in all those social media outlets and the news. I think it's important to identify and filter reliable sources of information. We know that there's a lot of misinformation out there, so we want to be able to know and access what's reliable, so that we then aren't overwhelmed by things that are more emotionally driven or misinformation. Simplifying access to key resources and even delegating, right? So I think what we see really nicely in this presentation is that this can be a group effort. So we don't have to work in isolation as mental health professionals. We can also work very closely with legal professionals, with community resources, with church, with clergy, with really anyone in the community, and really be able to work together so that we're not carrying these burdens and we're not carrying all of the emotion that our clients bring to us on our own shoulders. We're really delegating and finding support for ourselves, but also sharing the support with our clients. A model that I think is really applicable to what we're all talking about is the biopsychosocial model. This was created by a psychiatrist back in 1977, and what it did was it sought to put health and mental health at the core of these overlapping systems. So biological factors, psychological factors, and social factors. And so while this model in its inception was really intended to think about health more broadly, more contemporarily, it's used to think about things like trauma and pain in a holistic manner. And I don't think it's a stretch of the imagination to think about our current landscape as traumatic for many or most people, where we're constantly in a state of exposure to information that triggers fear, uncertainty, threat. I think those are words that we've been hearing over and over again in this presentation. And as the current immigration climate does for our community, a trauma response is common, and I'd even go as far as to say that it's expected. So I think, we'll talk a little bit more about what this model looks like, but I think it's really helpful to think about how all these different systems are activated and intersect to inform what's happening with our health and our mental health, or what's at risk. So biologically, when our body enters a state of threat, be it by a threatening mandate, a sensitive news headline, we respond by entering into fight or flight mode. Our nervous system is activated and manifests different physiological symptoms. And I think an important point to say here is that these things can be different for different people. So it's not uniform, but it's important to think about, well, what does that look like for me, right? Things like elevated heart rate, feeling that flush throughout our body and in our face, somatic symptoms such as muscle tension, pain, digestive issues, chronic headaches, fatigue. I think for a long time, again, speaking for myself, I would say, why do I feel so tired? It's like, oh, well, we are containing narratives and emotions throughout our day, and we're shouldering that, right, of our clients. And so that then takes a toll on our bodies, right? And I think the other important thing to talk about is the duality that's happening. So we're not only doing that for our clients, but we're experiencing that ourselves as people and as families who are also feeling under attack by all these mandates. We know that these experiences can then lead to more serious health issues such as depression, anxiety, and it's why some mindfulness practices, boundary techniques that we just talked about, and just regular self-care is really important. The psychological piece is understandable. A whole plethora of thoughts and feelings can emerge and be triggered. And again, those can be different for different people. Anxiety and panic are common reactions because in the face of raids and deportations, we feel fear of the unknown, cultural displacement. As we mentioned earlier, immigration security also challenges one's sense of identity and belonging. Immigrants may struggle with a sense of displacement, with cultural loss and feelings of alienation. And these factors are psychologically significant as they can impact self-esteem and the ability to form stable and supportive relationships. Other things that really come up for people are sadness, grief, anger, irritability, frustration. I think that those are all feelings that are important to name and normalize for people, that it's okay to have those reactions, that it's okay to feel those feelings, because once we are able to name them, to talk about them, then we can think about how to mitigate them and how to kind of address them for ourselves and for our clients. Next slide. So social and cultural factors are the social and cultural ramifications of threat and fear. And so what that might look like for people are feelings of exclusion, rejection, isolation, threats to a sense of belonging and community, and a sense of safety in their immediate surrounding. Reducing a social support network, kind of questioning who can I lean on, who can I turn to for support. Am I welcome in just about every environment? I think some of the examples that were touched on throughout the presentation. Can I step into my place of employment and now feel like a welcome person? Can I go to my place of worship and feel like I'm welcome, or I'm going to be looked at, or I may be detained? So our social worlds very much change. The lives of our communities very much change by these feelings of threat. And so that then changes the social networks that we rely on, the way that we socialize, and I think more often kind of alienates people and isolates people, also putting them in a more vulnerable place for psychological distress. Next slide. So some of the benefits of thinking about all this is what it presents is a really holistic approach to understanding health and mental health. So here we are, pulling from all these overlapping structures and understanding them integratively to then be able to inform what's happening both physically and behaviorally or in a mental health space. There's really an emphasis on resilience as well. What this model helps to inform is an individual's subjective experience of trauma. So what you've heard me say is that these things can land in different places for different people. Different triggers can emerge for different people. And so it's really about an individual's subjective experience of trauma. And that then empowers clients to be active participants in their own healing. What we see here is a really person-centered approach that encourages individuals to explore all elements of themselves, their mind, their bodies, their emotions, their environment, their cultural nuances, any genetic predispositions, and how all of that interacts and contributes to trauma or what it is that they're experiencing now. And so what that then produces is greater self-awareness, sense of agency, empowerment, resilience. And I think the other really nice point about all of this is that it promotes a multidisciplinary approach. So here we can think about how we can work closely with physicians, how we can work closely with clergy or spiritual members, spiritual leaders, trainers, yoga instructors, like really work in a multidisciplinary manner to promote wellness and to promote healing for people.
Thank you, Angela, for bringing awareness to all of that. Something that I want to add to that is when we're speaking about somatic symptoms, and that's really noticing the tension in our shoulders. I don't know about everyone, but when I'm stressed or I'm experiencing a lot of information overload, or even receiving information or speaking about this information, I start feeling a lot of tension in my shoulders. My neck might feel a little bit more stiff. It might be a lot harder for me to move, right? And so why am I saying this? I'm saying this because it's really important sometimes to understand that people may not have the language or the words to put around what they're experiencing, right? We're getting all this information, and sometimes it gets stored in our body. We might not necessarily be able to say, I'm really scared right now. I'm really angry right now. I'm really sad right now. Like sometimes we have trouble being able to put those words. And so it's so important to be able to notice what is being stored in our body. What is our body informing us and telling us, right? Not only for ourselves, but for other people. We might see people that are not putting words to what they're experiencing, and being mindful that that doesn't mean they're not experiencing a burden or heaviness. It just might be stored in their body and what that looks like. Okay. So I just really wanted to put emphasis on that, especially as we're receiving this information. So with that being said, why don't we all go ahead and take a moment to check in with ourselves and see what are we experiencing as we're taking this information, as we're engaging. Are we noticing any tension on our shoulders, right? I have heard before, a Pilates instructor has told me, like, our shoulders are not meant to be worn as earrings, right? So the woman out there or for anybody, is take a moment to notice, where are your shoulders? Are they up here? Are they down here? And even if you think they're relaxed, they're not. Go ahead and take a moment to roll your shoulders. Check in with your neck. Maybe take a deep breath. Or maybe you're like, Erika, I need a little bit something more active. So maybe you need to go ahead and just move your hands. And we're going to be transitioning to engaging in a skill, right? So there are so many skills and so many different things that we can engage in, but this one I was called to because, again, of what I was saying, right? Sometimes we don't have words to put into what we're experiencing, and sometimes all we can release is a sound. And that may sound like, I'm going to make different sounds. Just bear with me. Sometimes it might be like, ah, right? Sometimes that's all we can do. We can't put words. We've had an exhaustive day. We've looked at all these headlines. We've had people share. We've stepped out to the community. We're going to get our nails done. Our nail techs are speaking about their fear of showing up to work, or telling you, I don't know if you're going to see me next time. So vocal toning is a practice that involves using your voice to produce a sustained sound. So that could be something like ah, oh, right? And there's different benefits to being able to do this. There's benefits of stress reduction. It helps with breathing better. It really helps to strengthen your immune system and higher energy levels. I find this, again, particularly helpful because some of us right now, we may be in the state of feeling like really active and wanting to engage. Some of us may feel a little more like withdrawn and feel like, whoa, like I don't know what to do with all this information. Before we jump into this, a few things I want you to notice. You can really play around with the tones, right, of what that feels like. So bear with me. I'm going to make some sounds, but just to highlight the difference, right? So if I'm feeling a little calm or maybe a little withdrawn, my might be or I may feel really angry and I'm like, I need to get all of this out. So my is like, and I need to scream and let it all out, right? So again, that's just highlighting how different emotions might be showing up. And this is really going to give you the opportunity to just express whatever it is that you're feeling. All right. So thankfully, we're all on mute, so we won't be hearing each other scream. So go ahead and start finding a moment to find a comfortable position. Maybe take a deep breath. Notice the support of where you're sitting. If you feel most comfortable, maybe even putting your video off at this point, just because you're going to be making noises, or you might feel like, hey, this is actually something that I'm not feel comfortable with, then go ahead and maybe get up and move, play some music, dance, just take a moment to just check in to see what would be most helpful for you. So again, at this point, if it feels most comfortable to turn off your camera, go ahead and do so, but find a comfortable position. Go ahead and start relaxing your body. Again, especially your shoulders. So roll your shoulders, maybe nod your head gently, no. If you're being called to it, take a deep breath. Move your jaw, maybe close it, open it. And choose a vocal sound that really resonates with you. So again, I gave you a few options. It could be and start vocalizing at a pitch that feels comfortable to you. Again, that may look different to you than it does to someone else. So just focus on what that experience, what it is that your system may need right now. Experiment, feel free to experiment with the pitches. Again, we're on mute, so go ahead and get as loud as you want or as quiet as you need. And as you're doing that, go ahead and start focusing on the vibrational sensations in your body. Notice where you're feeling that vibration in your body as you're making these sounds. As a reminder, just go ahead and express any emotion that needs to be expressed right now. Whether that's anger, whether that's sadness, whether it's rage, maybe it's calmness. Whatever it is that you're experiencing, allow that to vibrationally feel through your body. So continue noticing that vocal sound, noticing the vibration through your body, especially in your shoulders and your neck. And when you're done, go ahead and take a moment to check in. Notice any shifts in your body. Notice what that was like. Notice if you need an extra movement. Maybe it's a big, deep breath, maybe, right? I'm just offering you a buffet of options right now, and you take what you need or leave behind what you don't need. So maybe it's, again, taking a deep breath, breathing in through your nose, breathing out. And by the way, let behind any ideas of breath, that breath needs to sound a specific way or needs to sound pretty. Breaths can be sounds. Breaths can be warning. It can be a big sigh. So really just allow yourself to experience anything you need to experience right now. And with that, we conclude this part and we're going to transition to checking in and any questions you may have.
I want to take this time to really genuinely thank everyone for your participation. We are all in some capacity on the front lines of this, and so it's important that we get informed, and it's also important that we find community and that we feel a sense of support through all of this. And a special note of gratitude and appreciation to Veronica and Ivonne, Erika, for being key and expert speakers on these topics. You each spoke very fluently and vividly to the reality that we're living in, and also to how we can support ourselves and support our clients. Thank you for being here and for sharing your expertise with us. All handles are linked here, and I invite all of you to jot them down, to visit them, to see all the additional programming and information they're putting out, because it'll be just as relevant. And I will end with just one last plug. Our annual conference is in just a few weeks on March 21st. Registration ends on March 14th. We will be continuing this community building, making these connections, talking these hard conversations, supporting one another, celebrating one another with the award recipients that will be honored that day. It's going to be a really great day, and I really encourage all of you to attend if you can. If you are planning to attend, don't forget to bring your children's book to support to that cause. And please donate to our scholarship fund. We really appreciate that. We really want to continue to invest in our students in the future of mental health field. So please be encouraged to make that donation. Thank you all and have a great night.